Good morning. My name is Mary Mutheki, and I am a nurse manager from Stockton Community Health Center. Today, I will discuss how government policies related to your health and safety affect the coordination of your care. Then, I will discuss national, state, and local policy provisions that raise ethical dilemmas for your care coordination. I will also talk about how the Nursing Code of Ethics affects care coordination and the continuum of care. This meeting aims to give you information that will help you access healthcare to improve your quality of life. Let's start by looking at government policies affecting coordination care of homeless shelters. One government policy affecting your coordination of care is the Patient Protection and Affordable Act, also known as HIPAA. It was made into law in March 2010 under President Barack Obama. The HIPAA's three main goals are to increase patient access, improve the standard of service, and cut healthcare costs, as discussed by Collins and Sayer in a 2018 article. The government, through HIPAA, makes sure everyone has access to healthcare. HIPAA has three benefits. It makes health insurance more accessible and affordable. 2, it ensures the type of coverage to help exit homelessness. And 3, it focuses on the value and outcome of healthcare delivery. The HIPAA expanded Medicaid coverage to be eligible for all homeless people for free. There are 3 ways to apply for Medicaid extended coverage. 1, you can go online to healthcare.gov and apply. Or you can call through via phone at 1-800-318-2596. Or they have local enrollment sites that you can go in person and apply. A study by CEO et al. In a 2019 article suggested that having continuous Medicaid coverage appeared to mitigate barriers to care among community health centers patients in underserved populations compared to having intermittent or no insurance coverage. Therefore, it is good to apply for Medicaid insurance coverage. Some of the benefits covered by expanded Medicaid include primary care appointments, diagnostic tests, hospital visits, surgical procedures, behavioral health services, mental health treatment, substance abuse treatment, prescription drugs, preventative and wellness services, and rehabilitative services. Another government policy that we'll discuss is HIPAA, which is Health Insurance Portability and Accountability Act of 1996, called HIPAA. This is a federal law that mandates the development of national guidelines to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent, as discussed in Health and Human Services website, 2022. The HIPAA privacy rules' main objective is to ensure that patients' health information, which is PHI, also called PHI, is appropriately safeguarded while enabling the flow of health information required to deliver and promote high-quality healthcare and to safeguard the general public's health and well-being, as discussed by CDC and Prevention website, 2022. Patient health information is any information that can identify you For example, your name, date of birth, address, social security, or phone number. HIPAA puts a limitation on how agencies can use the PHI. Many community clinics use electronic medical records to document the care they deliver to their patients. Different agencies can share this information to coordinate the care of patients. HIPAA helps to avoid misuse of this information by enforcing agencies to maintain confidentiality of PHI. Now let's look at provision raising ethical dilemma for care coordination. In 1987, President Reagan passed the McKinley-Vento Homeless Assistance Act as a federal law to provide money for homeless shelter programs and support the education of homeless children and youth, as discussed in Federal Fundings for Homeless Programs website, 2023. President Reagan named it after Stuart McKinley, a supporter of the law, and later it was renamed by President Clinton after Bruce Vento, a supporter of the law too. That's why it's called McKinney-Vento Homeless Assistance Act. Every year, the United States Department of Housing and Urban Development, also called HUD, HUD, gives money to the homeless assistance grants to communities that offer housing and services at the local level. The Emergency Solutions Grant Program, also known as ESG, and the Continuum of Care Program, known as COC, serve the communities at the local level. The ESG award funds street to outreach, emergency shelters, quick rehousing, and homeless prevention and diversion. The COC program supports coordinated entry, quick rehousing, transitional housing, permanent supportive housing, and pilot programs like the Youth Homeless Demonstration Program. Sometimes the money granted by HUD every year to ESG and COC is not utilized if people who are homeless do not access it. Having knowledge of which opportunity is available for the homeless community will help end homelessness and improve quality of life. The COC helps transition homeless people into their homes, which makes them feel safe, as discussed by Garcia and Kim in a 2020 article. Let's now look at the impact of the Code of Ethics for nurses on the coordination and continuum of care. Giving homeless people access to high-quality health care while trying to reduce homelessness puts moral motivation and good intentions into action. Ethical principles of autonomy, beneficence, non-maleficence, and justice are essential for nurses when they encounter ethical dilemmas. Nurses must adhere to ethical practices regardless of who they care for. The nurses respect the need for autonomy for a homeless patient in the clinic. Each patient has the right to decide based on their beliefs and values. If a patient refuses to take the medication prescribed, the nurse respects the patient's decision, even though it conflicts with what the nurse thinks is the best. To ensure the continuum of care, the nurses treat patients with kindness, minimize harm, and enhance their well-being, which applies beneficence to their practice. Non-maleficence requires nurses to cause no harm to the patients. In community clinics, if a homeless patient decides to stop taking a vital medication, the nurse feels morally and ethically challenged because she understands that missing the medication can cost the patient his life. Nurses must treat all patients equally and fairly, whether they are homeless or not. According to O'Carroll and Wainwright in a 2019 article, homeless people tend to avoid healthcare services, and others have poor compliance with seeking treatment, which can result in them presenting to the hospital late into the course of their disease when it is critical and overwhelming. Therefore, seeking medical attention early enough is essential. Coordinating care of a homeless patient can be challenging while applying the code of ethics due to the lifestyle that comes along with being homeless. Since the patient might not have a phone number or an address, the nurse has to respect the patient's autonomy while offering transport to get to the appointments. The nurse must apply autonomy, beneficence, non-maleficence, and justice while coordinating the care of a homeless patient. In conclusion, I would like to say this. The federal government has policies like HIPAA and HIPAA to ensure homeless populations have access to medical care and that their PHI is protected. These policies aid in the continuum of care, which enhances the quality of life. The policy provisions, like the McKinley-Vento Assistance Grants, allow grants to ESG and COC. The homeless population should make use of these resources to better their life. Nurses are dedicated to ensuring a continuum of care for the homeless population by applying the codes of ethics in their care. Thank you very much.